It's my feel-good breakfast show.
Welcome back. You are with Expresso right here on SABC3. Now, the coronavirus, also known as COVID-19, has spread from Wuhan in China and has now spread all around the world, all over the world. The virus went from being a public health emergency of international concern to what we're seeing today, an absolute pandemic. Now, this has forced billions of people to go into lockdown, including South African citizens. Now, at least 3 people have now been reported to have died from this virus. And our trusted medical health specialist, Dr. Darren Green, is joining us via video call to give us the latest update on COVID-19. Dr. Darren Green, good morning. What is the latest statistics on the coronavirus in South Africa? How many people have been infected at the moment as it stands? I know that 3 have died. Have there been any recoveries at all, Dr. Green?
Yes, morning, Tabs. The total amount of positive confirmed cases was sitting at 1,326 when I last checked. And as you rightfully pointed out, 3 people have been confirmed to have passed from the disease. And then we have a total amount recorded of recovered cases standing at about 31 at the moment. So those are just what's happening on the local front in South Africa.
So it's a bit of a silver lining when we hear stories of these recoveries and they just sort of keep us in the positive. But what is the update as far as the worldwide statistics are looking like? How many people have tested positive for COVID-19 all over the world?
Yeah, I think if you look at the world stats obviously reflect a total amount of confirmed cases in excess of 792,000, obviously. And that's quite a significant amount. And if you think about that, for a moment, it's just massive in terms of the amount of infection that has spread. And obviously, we need to be mindful of that when considering what could happen on our doorstep.
And Dr. Green, what is the death rate and the recovery rate looking like on a global scale? What are we looking at? What are those numbers looking like?
Yeah, well, we've got a total death rate just under 68,000 worldwide at the moment, and a recovery of the 792,000, 166,000 cases have been documented as being fully recovered. So that's where we're standing at present.
And the numbers don't lie. They show and they paint a really, really concerning picture. Now, I had a conversation earlier on with the Western Cape as Minister of Health, Noma French, and they're urging the public to stop using gloves and masks. Why is this? Aren't gloves and masks meant to protect us from the virus, Dr. Green?
Yeah, it does seem rather ironic, doesn't it, that in the case of an infection and a pandemic, we tell people not to wear gloves and masks. But understanding the transmission and how obviously infection is controlled is quite important. Rightfully so. If you think about it, people that wear gloves are doing so and get a sense of security that their skin and their hands are protected. But what that actually leads to is less hand washing. In other words, they're keeping the same gloves on. If you go to any shop for crucial and essential shopping, for example, if you're at the booms or even at the toll gate on a national road, when we as essential workers travel sometimes, you'll see people wearing gloves at these stations, but they keep the same pair of gloves on for hours on end. And that means that the infection, droplets, etc., could be colonizing those surfaces, and everything they touch then obviously acts as a medium of spreading the virus instead of actually lowering it. So gloves give you a false sense of security and reduce hand washing practices, which is one of the main reasons the guidelines have come out. So remember using obviously soap and water to reduce the amount of soiling and load on the hands, and then alcoholic sanitizer. Hand sanitizer. So that's the principle behind that. With masks, the other thing to mention that's quite interesting is that obviously we all know the virus is spread via droplets. We know that they're hydrophilic droplets. We know that they fall within a perimeter of 1 to 1.5 meters around you. They fall to the ground. And what people must understand is that people that are actually sick and coughing, they should be the ones actually wearing the masks if indicated, while being treated at a facility and so forth. The people that are dealing in the hospitals with working with positive cases are at risk of not having any equipment and what we call PPE, the protective gear. if the general public are just wearing masks, specifically the different types of masks, but specifically the N95 masks, and even surgical masks are in low volumes now available to health professionals that are working on the front line in contact with positive diagnosed cases. And that is why we have to advocate that masks are used for the right indication. So, hats off to the Department of Health and the drive from our local minister as well.
Thank you very much, Dr. Darren Green, for that update on the coronavirus. Thank you very much. It certainly seems that washing your hands and avoiding any contact with your skin, don't touch your skin, remains the most effective way to keep yourself safe from the coronavirus. Of course, more information, you can find that on sacoronavirus.co.za. And of course, if you want to get in touch and have any questions, or in case of any emergencies, there is an emergency hotline number that works 24/7. It has been set up, and you can get in touch with them on 0800 029 999. That's 0800 029 999.